Hi, I'm Mel. I'm one of the senior physios at Pelvic Health Melbourne, and in honour of Women's Health Week, I wanted to talk to you about a really common issue we see, which is bladder leakage. Did you know that there are a lot of reasons for bladder leakage, not just a weak pelvic floor? If you're younger, especially if you're very active, you might in fact have a tight pelvic floor, and a tight pelvic floor can't do its job properly. Another really common issue for younger people having leakage is what's called overactive bladder. So overactive bladder is when your bladder is either squeezing when it should be relaxing, or it's too sensitive. And that can cause a type of leakage called urge incontinence that can happen even with a very normal pelvic floor. Now, if you have had a baby, especially if you've had a vaginal delivery, you are a little bit more likely to have a weak pelvic floor. Childbirth can cause some stretching and damage to the pelvic floor muscles, and that can cause some weakness. But we do still see some ladies who've had a baby who do have either overactive bladder or a tight pelvic floor, so it's useful to try and figure out exactly what your pelvic floor is doing. If you do have that type of leakage, that's the coughing, sneezing leakage with some weakness of the pelvic floor, that's called stress incontinence. Now, if we're getting to ladies who are over 40 towards 50, we do start to see a little bit of perimenopausal changes. Now, when you have lowered estrogen around perimenopause, that means that the bladder is now a little bit more sensitive, and it can mean that the wee tube has less support, the urethra has less support, and that can mean we start to see a little bit more leakage around the 40s and 50s plus in those ladies. So there's a few reasons age related that this can be more likely one or other type of leakage. Did you know that at any age constipation can contribute to leakage? That can be a really big contributing factor. And did you know that there's another type of leakage called overflow leakage, where the bladder is simply getting too full and it's overflowing? So as you can see, there's lots and lots of reasons for bladder leakage, not just a weak pelvic floor. Luckily, there's lots and lots of things we can do about it. Check out the blog for ideas about treatment. That's it from me. Take care.